Lesson 8 covers handling and disposal of hazardous materials, a topic that spans OSHA's HazCom standard, GHS pictograms, medical waste categories, chemotherapy safety, and spill response. 4 minutes. High yield for the registry and essential for daily safety practice. OSHA's Hazard Communication Standard, HazCom, requires that every healthcare worker has the right to know about hazardous substances in their workplace. The Safety Data Sheet, SDS, is the core document for every chemical in your department. 6 sections you must know: product identification, the manufacturer's contact information; hazard identification, the signal word, danger or warning; composition, what's in it and at what concentration; first aid measures, what to do immediately on exposure; safe handling and storage, ventilation, incompatibilities, temperature requirements, and disposal considerations; how to dispose of the chemical and its contaminated containers. Know where your SDS files are before you need them. The GHS, Globally Harmonized System, standardizes hazard symbols on all chemical labels worldwide. 6 pictograms tested on the ARRT: skull and crossbones, acute toxicity; harmful if swallowed, inhaled, or absorbed through the skin; flame, flammable; keep away from all ignition sources; irritant or harmful; lower hazard than skull, but still requires precautions; corrosion, causes skin or eye tissue destruction on contact; biohazard symbol, biological hazard; blood, body fluids, infectious material; and the radiation trefoil, radioactive materials. Ionizing radiation hazard present. 4 chemicals found in imaging departments that require specific handling knowledge. Fixer solution, contains acetic acid and ammonium thiosulfate. Skin irritant, respiratory sensitizer. Work in ventilated areas. Dispose as photochemical waste. Developer solution, highly alkaline, pH 10 to 12. Eye and skin hazard. Chemical burns possible. Nitrile gloves and eye protection required when handling. Gadolinium contrast agents, nephrotoxic. Handle per IV medication protocols. Dispose as pharmaceutical waste. And barium sulfate, aspirate risk if swallowed incorrectly. Requires thickening modifications for dysphagic patients. Dispose as regular medical waste, not biohazardous. 4 waste stream categories. Knowing which waste goes where is both a safety and regulatory requirement. Red bag, biohazardous. Blood-soaked materials, body fluids, contaminated sharps in a sharps container, pathological waste, and microbiological specimens. Yellow and black striped, pharmaceutical waste. Unused medications, expired contrast agents, gadolinium. Return to pharmacy or a licensed collector. Blue, chemotherapy waste. All materials that contacted cytotoxic drugs. Closed lid containers only. And regular waste, non-contaminated paper, dry packaging, non-contact disposables. Do not overbag. Over-triaging waste is expensive and creates compliance problems. Cytotoxic drugs are carcinogenic and mutagenic, even at small exposure levels. Skin absorption, inhalation of aerosols during preparation, ingestion from contaminated surfaces, and eye splash are all exposure routes. Safe handling rules. Double gloves with chemo-rated gloves. Wear impermeable gown plus eye protection for any preparation or administration. Handle in a certified biosafety cabinet. Label all waste as chemotherapy hazardous. Keep spill kits immediately accessible. And pregnant staff must notify and request reassignment from direct cytotoxic drug handling. 6 steps when a hazardous spill occurs. Alert and evacuate the area. Notify others of the airborne hazard if applicable. Call for help immediately. Identify the substance, check the container label, and SDS before approaching. If unknown, do not approach until the safety officer arrives. Don appropriate PPE as indicated by the SDS. Contain the spill using absorbent pads or kitty litter. Work from outside the spill edge inward. Clean and decontaminate. Use the spill kit materials. Wipe surfaces per protocol. Dispose of all materials as hazardous waste. And document and report. Complete an incident report. Notify your supervisor. Record the time, substance, exposure status, and every action taken. 3 hazardous materials questions. Think before the answer. The answer is C. Identity of the hazardous chemical and appropriate hazard warnings. OSHA's HazCom standard requires all hazardous chemical containers to be labeled with the product identifier and the appropriate hazard warnings. Internal secondary containers are not exempt. Unlabeled containers must be labeled immediately or removed from service. The answer is B. Rinse the affected area with water for at least 15 to 20 minutes. Immediate copious water irrigation is the universal first aid action for chemical skin exposure and is specified in the SDS First Aid section. Remove contaminated clothing during rinsing. Seek medical evaluation if irritation continues. The answer is C. Double gloves with chemo-rated gloves and impermeable gown. Cytotoxic drugs require double gloving with chemotherapy-rated gloves. Standard nitrile gloves do not provide adequate protection, plus an impermeable gown and eye protection for any preparation or direct contact activity. You covered HazCom and the SDS, GHS pictograms, imaging department chemical hazards, medical waste categories, cytotoxic drug safety, and spill response. Safe chemical handling protects you, your colleagues, and your patients.